So hello everyone, this is Dr. Humanist again. Suppose you're posted ER and you were a patient with a lot of focal neurological deficits, like one-sided weakness is there, aphasia is there, slurred speech is saying, and sensory deficits is also there. So what are the time target you should be aware of? We'll be discussing today about that. So when you receive a patient at 0 minute, when you assess the patient, you are suspecting for stroke. So firstly, you have to stabilize the patient, the airway, breathing, circulation, disability, A, B, C, D, you have to stabilize that. You have to rule out the common causes, like maybe which are treatable easily, like hypoglycemia and all that. It should be done, but you should order these things to the nursing staff, and with that, you have to do a clinical assessment within 10 minutes. Okay, what all things should be done within 10 minutes is you collect a history, brief history, the time of onset of symptoms, and any coma are there, or also the indications and contraindications of thrombolysis should be taken within 10 minutes by the duty on doctor. Okay, so then you have to calculate NIHS score. You should be very quick in that, and then we have to send the samples for the lab investigations. Okay, ECG you can do, but it should not delay the time to thrombolysis. You have to take care about that. So 10 minutes we should be doing all this thing as a physician or doctor on duty. Next 15 minutes, what you do is within 15 minutes you have to inform a stroke team, in that a neuro specialist or neurologist should be informed within 15 minutes that you have got a case like this. And within 25 minutes, what you do is you have to send the patient for neuroimaging, either CT or MRI. Okay, the next 45 minutes you should have the interpretation of the CT and MRI, what kind of stroke it is, if there is edema, how much it is, and all this should be interpretation should be there within 45 minutes. And the next 60 minutes is you have to, if the indications are all like it's a good candidate for thrombolysis, you have to start the thrombolysis within 60 minutes of admission or within 60 minutes of you receiving the patients. So these are the all time targets in the case of stroke. You have to be aware of the thrombolysis. So now when you made your diagnosis to be acute ischemic stroke, you have to think if the patient can be taken for thrombolysis or not. The Harrison has mentioned a very good table for indications and contraindications of thrombolysis. Indications, the age should be more than 18 years. You have made your clinical diagnosis of stroke, which is confirmed by neuroimaging. Onset of symptoms to the drug administration, the time should be 4.5 hours. So 4.5 hours is the window time you have got for the thrombolysis. If the time is crossed, we cannot thrombolyze. And CT scan should show no hemorrhage, and even if this edema, it should be less than 1/3 of the MCI territory. So these are the indications. The contraindications which are more important, the raised BP even after the treatment, if it's more than 185/110, or if the patient is having any bleeding diathesis or recent head injury or intracranial hemorrhage is there, major surgery within 14 days, gastrointestinal bleed within 21 days, and recent MI. So these are the contraindications. Also, the National Institute of Neurological Disorders and Stroke, they also mention about acute pancreatitis and pregnancy as contraindication for thrombolysis. And if you see the American Stroke Guidelines, they also include the heparin use within 48 hours and platelets less than 1 lakh. And if the patient is on anticoagulants, they advise to check the INR, and it should be less than 1.7. So these are the all indications and contraindications. The drug we use for thrombolysis commonly is alteplase. The dose is 0.9 mg per kg, and you have to give it within the infusion of 1 hour. The 10% of the drug is given bolus within 1 to 2 minutes, and the next drug should be given for 60 minutes, the 90% of the drug. To take care that when you're starting thrombolysis, within 2 hours of that, we should not put Foley's catheter, and also if any antithrombotic treatment should not be given within for next 24 hours. And if the patient is worsening, the neurological deficits are worsening, or the BP is uncontrolled, then you have to stop the infusion, send the patient to the neuroimaging again, and you have to give the cryoprecipitate, because now we are suspecting for hemorrhagic conversion of the infarct. Thank you.